HIPAA is Health Insurance Portability and Accountability Act of 1996, and basically it's what governs patient privacy. And it's enforced through the Office of Civil Rights. You can read a little bit more on this slide about that information. But basically, what you need to know about HIPAA is it's about protecting patient health information or private patient information. This is the pledge that you guys sign when you come to work when you contract with AOL and then come to work at the SCCA. And we're going to go over just really briefly what HIPAA covers, which is basically individually identifiable health information. And this includes the individual's past, present, or future physical or mental health condition. Let me make sure I'm trying to go through this quickly, so I want to make sure I'm right about this. So this, individually identifiable health information is, demographic data, and then there's a better slide that kind of breaks it down a little bit more specifically for you, which is this one. So any of this information is considered protected by HIPAA. So it is information that you cannot share outside of your role as interpreter, outside of the clinic. Actually, Edmundo's comment a minute ago about it being difficult to kind of process some of the appointments that you guys have to attend to here when you take assignments here at the SCCA, because of the fact that you can't discuss what you are working on here or who you're working with here at the SCCA. It was very apropos to what we're talking about here in HIPAA. This is all of that information beyond just the names and birth date and phone number, like the information about the patient's medical condition, their prognosis, their diagnosis, all of that stuff is information that is protected by HIPAA and that you cannot share. This is just in order to be compliant with HIPAA. So you just have to work together to make sure patient information is used and disclosed on a minimum necessary basis. Appropriately used, it would be when identifying information is shared among the medical team and other service providers as needed for the patient's treatment. That's allowed per HIPAA. Misuse would be when the information is provided or leaked to someone outside of the care team. Okay, so this applies in the course of your interpreting duties. So being very mindful of the information you receive electronically about patients, so the information you receive about their appointments, their name, their U number, what clinic they're being seen in, all of that. Making sure that your phones, any devices on which you receive this type of information are encrypted devices, and you have a password. They're password protected, so that if you should accidentally leave your phone in the cafeteria and somebody returns it to security, they can't access that information that you have on your phone. Hard copies and printed data. Very few of us carry around printed data anymore. Most of us keep it on our phone or other devices. But if you're one of those folks that carries around a printout of your appointment information, your assignments for the day, just making sure that you're not leaving the clinic with it. We have the recycling bins here at the SCCA all get shredded. I don't know if it's the end of the night or the end of the week, but they all get shredded. So basically, if you have printed information with patient HIPAA-protected patient information, just make sure that you're throwing it away in one of the bins in the clinic, and then you'll be sure that it's being properly disposed of. Just again, never identifying patient information outside of the clinic. Going back to that example of the misuse and the proper use, you shouldn't be discussing it with anybody outside of the treatment team and as it relates to an appointment. So we always, in talking with staff here at the SCCA, we always say, be mindful of when you're in elevators and, you maybe are talking to a nurse that was just in the clinic with you, or a colleague perhaps, just in open space areas, making sure that this is something that you always are keeping in mind as you work throughout the clinic. again, when debriefing about your day, you know, as Maya said, it's natural for us to want to kind of talk to another individual about something, you know, that we've been through or how we felt, how that day had gone, just making sure that you're not using specific information to discuss that. Let's see. Oh, conflict of interest. So if you're assigned to interpret for somebody who you're acquainted with, know personally, it's best to recuse yourself from that appointment. So what I've encountered with this particular idea also is that sometimes the patient, you know, you as the interpreter may say, I don't know this patient personally. I've interpreted for this patient at another hospital, at another clinic, but we don't have a personal relationship. So there's really no reason. I don't consider it a conflict of interest, and there's no reason for me to recuse myself. However, if the patient feels the slightest bit uncomfortable with the thought of, you know, I know this interpreter, like I've worked with them before, it's probably best to just go ahead and say, you know, I'm not going to accept this assignment. You know, we can talk about that more, I guess, once we go into the ethics of it. But I just, you know, I do want to say that if the patient at all feels uncomfortable, we're going to try to make them feel as comfortable as possible with the situation. And, you know, again, if you become aware of unauthorized breach of patient's PHI, then you need to notify AOL, who will notify me, of course. And then, you know, these precautions, you know, they seem common sense, but it's really important to be aware whenever you are in the clinic, whenever you are on assignment, just being aware of your obligations to protect patient information. And then I think that we're probably not going to go through the scenarios just because I have a feeling that you guys are going to discuss some of this in the ethics presentation. And because we are a little short on time, I think I'm just going to leave it at that. Any questions about HIPAA?
No, just important to remind also to log out of the system when you use the computer to the third floor. The family that when you use your email.
Yeah.
Happens a lot.
That's a really good reminder. Thank you. Yes, so as you all know, that you're very welcome to use the resource center on the third floor. But it is really important to remember to log out of the computers if you use them, and also to use the cover sheets if you ever use the fax machine to fax your timesheets or schedules to the agency, making sure that you're using the cover sheet, because if you walk away and the confirmation comes back in without a cover sheet, it's going to have protected patient information on it. So
one other thing, it's not just log out. If you are sending your timesheet, it will, because the computers are networked, it will automatically save to network, even if you save it on a memory stick. So you actually have to restart. So you go down to the start button and select restart. Otherwise, it will remain in
The hard disk. So you have to file. You erase it.
Right, but yeah, but you can erase it. But if you don't restart, it'll stay in spreadsheet program. I've noticed that. I've actually showed people stuff on.
I showed.
yeah, well, I wasn't familiar with that. I don't use the computers on the resource center but yeah, that's helpful. Like, so
I mentioned it to Zana, and she actually sent out an email to that effect.
Okay, very good. Thank you.
Actually highlighted in yellow on all of the timesheets that I sent to you. Please restart the computers after you use them. It's just the best practice.
Great. Any other questions about HIPAA? Okay, we're going to move on then.